Hi, my name is Sarah Rodriguez, and this class is English 101. This video recording is for my research paper, and my title for my research paper is An Imploding Healthcare System. Um, we watched a video that was called Fire Escape in the Healthcare System, and it gave me the inspiration to want to investigate more, being that I do also work as a healthcare worker. But in the documentary, there were many things that were identified that I was interested in because it identified and kind of unearthed a lot of problems within the healthcare system. One of the most interesting ones, or information that I did find, was the information on the telomere. The telomere ends at the end of the chromosome. Of course, I did learn something about chromosomes prior to this, but learning in more further in a deeper depth of the chromosomes, what they are, is part of the DNA that's inside of every living cell, and how the telomeres, um, you know, based on the length of the ends of the telomeres, it's all those factors are they're influenced by our lifestyle, how we exercise, how we take care of our bodies, how we eat. And doing that research on the telomeres, it also led me to other things, realizing how food being processed, how it affects us overall, our health. It affects our mind. Even food has even led to, by some of the studies, it's even led to autoimmune diseases, which with shorter telomeres, autoimmune diseases they're more prevalent. And an autoimmune disease is when the body, basically the immune system, it gets confused and it attacks its own body cells. In that discovery, I also did research and found out about drug abuse, and finding out about the statistics of how much misappropriation of physicians prescribing medication, how often that happens, and it actually happens at a high rate. Of course, it's quite common that people know um, juveniles have a much higher tendency to misuse of prescription drugs. And what I found in research is typically what the youth do, they either buy it or they get it from another person, a family member or someone that has been prescribed that medication for pain. Um, Very interestingly, as I was doing my research, I found out that there are, in many cases, there are a lot of procedures that are initially ordered by the doctor, and they're not necessarily beneficial to the patient. Back surgeries, knee surgeries. And very interestingly enough, I went on a website and found out that up to 40% of back surgeries, the patients end up in more pain than the back surgery was intended to relieve the pain. Very interesting enough, I found that out. Um, Also, inside of the documentary, they mention about acupuncture. I kind of heard something, had a little information about acupuncture prior, but it piqued my interest, and I went to a website by Dr. Well. He was also in the documentary of Escape Fire, and in the information, the article that I found is that acupuncture has been around for like 2,500 years. Chinese have been using it as medicine, or instead of medicine. And what acupuncture does is it helps. It helps relieve the pain by balancing out the energy flow. And what acupuncture is basically inserting needles, very thin, small needles into the affected body parts, and this is supposed to help relieve pain. Um, Another thing that I had found out during my research when I was looking up failed surgeries or relating to like back surgeries that fail, I found that there is a chronic pain syndrome that sometimes occurs when um, if a person is in pain for extended length of time. And chronic pain syndrome, it could be a result of surgery that either got worse or nerve damage. It could also be something that's related to even an underlying disease that I found in my research as well. It's really important that chronic pain is identified appropriately by the doctor. And as identified by my research and also in seeing the documentary Escape Fire, is that a lot of physicians, they are paid by the service, they are paid by the procedure. So in a lot of cases, a lot of times they feel pressured that they kind of have to see a patient as quickly as possible to get them in and out to gain the most profit. And in doing that, what I found inside some of the research I was doing is that there are many times physicians, not necessarily intentionally, but things are missed by not taking the time to really find out what is going on with the patient, why they're ill. And just to give a little information about chronic pain syndrome, chronic pain syndrome is a pain that it lasts longer than 6 months. Anything less than 6 months would be considered acute pain, but anything beyond that is chronic pain. Along with the information that I was finding, whether it had to do with big pharma or medication, physicians, ordering certain medications, maybe I found that there was corruption. There was corruption, and I also came across a website about the certain penalties that if legislators or politicians accept. Of course, it's not really talked about too much, but it does happen, and some do end up getting in trouble, into serious crime, serious violations, and but the unfortunate thing is that in many cases, a lot of the corruption, they're able to buy off judges, and they're able to maneuver their way throughout the system. So that's how these things, they are allowed to go on. And if I have a question, my one question that I would ask is like, how can we reform our healthcare? Reforming our healthcare is very, very, it's important that we do. It doesn't matter, what color we are, what race we are, what political affiliation we have. All of us, or there's a good majority of Americans, are very concerned about healthcare reform. And it's for good reason. We have to stop and acknowledge, one, in the research, as I mentioned, by not having, a doctor to fully assess what's going on with you, because one, maybe if you don't have insurance, nobody wants to see you because they're not going to make a profit. Even the type of insurance you have, you'll get preferential treatment. If you have Medi-Cal, you may not get as good treatment as somebody with Medicare or maybe private insurance. So that's another thing to that we have to consider. Then the other side of it is the amount of revenue, the money that we're going for, that are the U.S. spends. It's probably second or number one in the world as far as the countries, the healthcare systems. And if you look at our survival rate, our life expectancy rate, we're about 50. Though there's something's wrong if we're spending that much and our life expectancy is 50. So yeah, that would be my one question that I have, and I hope that someday, we will have a true healthcare reform. But what can we do to fix this? It's something that does need to be addressed. Thank you for watching my video.